The Otho S.A. Sprague Memorial Institute, which is a 112-year-old foundation founded by a man who worked successfully in Chicago and met the Rockefellers, met the Carnegies, and decided that what they were doing with philanthropy and foundations was a good idea. So the Sprague Institute is one of the 18 oldest foundations in the city, in the nation. And it's not the biggest, but there was a mandate to work at health and wellness in the city of Chicago. And an all-volunteer board has implemented his testamentary intent for all these years. As issues evolve, it also evolved from a group that actually hired academic researchers, scientists, men and women and minorities, to look at the issues of the day in 1911. Those look like lung disease, those look like schizophrenia, those look like other things we're still working at, but these were pioneering efforts. There were no antibiotics, there were no vitamins. This was a different time. So the Sprague Institute worked at that. Over the years it evolved. And the constant is to look at context. What's going on? What are the needs? How do you prevent illness? How do you stimulate wellness? In 2001, the nation experienced the SARS epidemic. And the Institute was concerned, what should we be doing? So Whitney Eddington, who was the board president at the time, and I went to visit John Wilhelm, who was the commissioner of the Chicago Department of Public Health. And we asked them, what do you need? And John said, I need data. I need information. I don't have enough of that. And if you can help me with that, that's what I would ask. So we did. And we created a program within the Chicago Department of Public Health that looked at various diseases and their prevalence in the community. Things like smoking, asthma, so forth. But then we also worked to create an epidemiological program. And Patrick Lenahan, who was on the faculty here ultimately after he retired from the city, worked at that piece of it. So there were two component parts. The Sprague Institute created CLOC, the Consortium to Lower Obesity in Chicago Children. My goal was to find a community that was hard hit, and that turned out to be Humboldt Park. And when we did research there, we learned that community suffered from numerous health issues. Lots of asthma, lots of diabetes, lots of overweight children. And so a community like Humboldt Park was alerted to their health situation, rallied around the bad news, and vowed to change. So they created a whole network of community-based agencies and citizens who were advocating for improved health. The Atlas speaks to those people. The Atlas speaks to other neighborhoods as well. It is evolving. It should keep evolving. And the context is always critical. If we didn't care about opioid overdoses a few years ago, now it's front and center. How do we track that? How do we deal with the new arrivals? That information is really important to neighborhoods and to the city at large, to funders and to policymakers. Posting that, getting it as accurate as can be, and then encouraging the researchers to look at that longitudinal information and make some conclusions. It's not just a nice tool, it needs to be a useful tool. And I'm all about action. So if there are activities that emanate from a nice portrait of a neighborhood, that's a success.